Hello everyone, I'm Dr. Forooshani and this is the first episode of our new podcast about borderline personality disorder, also known as BPD. Borderline personality disorder, or BPD, is one of the most misunderstood and stigmatized mental conditions, not only amongst the public but also amongst health professionals. This mental condition is developed based on the interaction between genetic-based emotional sensitivities and childhood experiences of abuse or neglect. This can be any type of perceived abuse or even very subtle experiences of bullying and neglect in childhood. People with BPD belong to a broader category of neurodiversity, which is called highly emotionally sensitive neurotype. When someone is born with this neurotype, they are vulnerable to developing borderline personality disorder if they go through significant experiences of neglect or abuse in their childhood. However, they may not develop BPD if the environment is supportive enough towards their sensitive emotional needs. So, in simple language, BPD is a trauma-related disorder that can happen to people who are born with highly emotionally sensitive neurotype. However, after recovering from BPD, they still need to be considered as neurodivergent people because highly emotionally sensitive neurotype is a type of permanent neurodiversity and not necessarily a disorder. People with a history of borderline personality disorder feel both positive and negative emotions in a much stronger way than what neurotypical people can feel. Therefore, their reactions to emotional triggers can also seem extreme and exaggerated. They usually perceive certain emotional cues in their social environment that cannot be easily obvious for neurotypical people. So, when they react to such emotional cues, their behaviors may seem confusing or unpredictable to people around them. Because of their traumatic childhood, people with BPD have a very insecure attachment style. That means that they are terrified of being rejected and abandoned. Because of this fear, they carefully monitor the reaction of other people all the time to detect any potential cue of rejection or abandonment. If they perceive any sign of rejection or abandonment, it causes them a high level of emotional pain. In reaction to this extreme feeling of pain, they may show extreme behaviors such as breaking up their close relationships, self-harm, and in the most extreme cases, attempting suicide. People around someone with BPD usually can only see their extreme emotional reactions without understanding the triggers that have made them to react in this way. As such, people with borderline personality disorder are usually judged as unpredictable or manipulative, which are completely mistaken beliefs. Because of these stigmas and misunderstandings, most people in society tend to avoid individuals with BPD. Even when people do not know about someone's BPD diagnosis, they usually still avoid and exclude them because neurotypical people cannot make sense of such extreme emotional reactions and mood swings. Unfortunately, such stigmatizing and exclusive attitudes are even common among many health professionals who are not sufficiently familiar with this mental condition. Even many practicing psychologists or psychiatrists are not sufficiently familiar with this type of neurodiversity, and you even can expect stigmatizing approaches amongst these mental health practitioners as well. In our next episode, we will discuss some of the most common stigmas and mistaken beliefs about borderline personality disorder, and we also will discuss the recovery pathways and supportive strategies.